Hey everyone, I'm Fitz, and for my portion of the Conditions Project, I was given the task of discussing the autism spectrum disorder, or ASD. I personally don't have any experience in working with those who have developmental disabilities or autism. Over the course of the last couple of weeks, I've learned a lot about IDD and ASD. In the Francis text, it states that the DSM-5 had combined the autistic disorder, the severe classic autism, and a milder Asperger's disorder. The Francis text also indicates that for the severe classic autism, the problems arise early during the infancy stage, which gravely impoverish the child's social interactions, language, development, and behavioral repertoire. Whereas the Asperger's disorder is a milder form of autism that does not require language impairment. According to the DSM-5, to meet the diagnostic criteria for ASD, a child must have persistent deficits in each of the three areas of social communication and interaction, plus at least two of four types of restrictive repetitive behaviors. The DSM goes on to indicate that those who are diagnosed with autism spectrum disorder have persistent deficits in the following areas: persistent deficits in social communication and social interaction across multiple contexts. They also have deficits in social emotional reciprocity, for example, from abnormal social approach and poor conversation skills, and lack of shared interest, emotions, or affect. Those who have autism spectrum disorder are also known to have deficits in nonverbal communicative behaviors that are used for social interaction, from poorly integrated verbal and nonverbal communication skills to abnormalities in eye contact, body language, or deficits in understanding the use of gestures, to a total lack of facial expressions and nonverbal communications. And lastly, those who are diagnosed with autism spectrum disorder have deficits in developing, maintaining, and understanding relationships. For example, they have difficulties adjusting their behavior to suit various social contexts to difficulties in sharing imaginative play or in making friends. The article I chose to use is called Gastro- Gastrointestinal Symptoms and Autism Spectrum Disorder: Links and Risks, a Possible New Overlap Syndrome. This article was found in the U.S. National Library of Medicine, National Institutes of Health. In this article, the authors define autism spectrum disorder as a genetically determined neurodevelopmental brain disorder presenting with restrictive, repetitive patterns of behavior, interests, and activities, or persistent deficits in social communication and social interaction. In the article, the authors report that children who have autism spectrum disorder are at a greater risk of gastrointestinal, or GI, concerns or issues. The autism spectrum disorder includes different levels of intellectual development and maturation, with dysfunctions of cognitive and perception which can be found in 50 to 70% of patients, which can correlate with the severity of autistic behavior. While reading this article, I found it very interesting that the studies conducted by the CDC showed that in 1978, 1 out of 10 children were diagnosed with autism spectrum disorder. 20 years later, in 1999, the number went down to 1 out of 250 children. In 2007, the number was 1 out of 150 children. And as recent as 2010, the number went down to 1 out of 68 children diagnosed with autism. In their study, they conclude that boys were more likely to be diagnosed with autism on a scale of 1 to 4 to 1, excuse me. Some recommendations for how to diagnose and or evaluate autism spectrum disorder are genetic testing in children. The article indicated that screening in children can be done as early as 9 months, 9 months old in a child. I know from personal experience when my wife was pregnant with our first child 3 years ago, and with her current pregnancy, the doctors did genetic testing to see if the baby or the current baby would be predisposed to any genetic disorders. So I know that technology has gotten a little bit better, and while there is still no cure for autism, um, just because it's so broad and not every course of treatment is going to be the same for everybody. Hopefully, as things get better, um, doctors will be able to develop better interventions to help those who are diagnosed with autism spectrum disorder. I do hope that you enjoyed this presentation. I look forward to learning new information that were presented in the other presentations. Take care.